I'm Brittany Lewis with Forbes Breaking News. Senator Roy Blunt discussed the Bipartisan Safer Communities Act on the Senate floor Thursday. His remarks centered around mental health components in the bill. The Missouri Republican worked with Michigan Democrat Debbie Stabenow to include mental health measures in the legislation. Take a listen as Senator Blunt explains.
Madam President, before I get to my topic today, I'd like to say that when Senator Sullivan first came to the Senate, I hadn't been here very long either, and this was my presiding time every week, and I loved the Alaskan of the Week. I don't think they're ever going to run out of Alaskans of the Week as long as Senator Sullivan is here, and so I was just right back in that chair where you are, thinking of the many times I heard Senator Sullivan do the presentation on the Alaskan of the Week and how much I enjoyed it. I would say the topic today, tragic in so many ways, but I think moving forward in others. You know, last month, 19 kids were killed in their own schoolrooms. 2 teachers were killed at Uvalde, Texas. It was a horrific act, agonizing thing for family, an agonizing thing for community. And I think along with the Buffalo, New York event, an agonizing thing for our country. One thing that almost all these mass shootings have in common is a perpetrator who had a mental health issue that wasn't dealt with properly. And let me say before Senator Stabenow and I talk any more about mental health, and I believe I'll repeat this again to be sure we know what we're talking about here. People with mental health conditions are not dangerous. Mental health is a health issue, and we ought to treat it as a health issue. But in rare and tragic occasions, people with a mental health issue undealt with can become dangerous, and that's what we've seen in this and other similar circumstances. And so one of the responses is always, well, we need to have a better mental health delivery system, and that's true. But we should realize that according to National Institute of Health, for at least a decade now, they've estimated that at least 1 in 5 Americans has a diagnosable and almost always treatable mental health or behavioral health issue. And frankly, the pandemic made that even greater. A June 2020 survey by the Centers for Disease Control and Prevention found that 41% of adults in the United States said they'd had at least one symptom of a mental health condition in a recent time. And 11% said they'd seriously considered suicide in the previous month. Now, those are extraordinary numbers, but even if they were, half of those numbers were correct, you see the size of the problem we have and the importance of dealing with that problem. Of course, we had even more alarming numbers with children and young adults during that, lockdowns, months of virtual learning, time away from their friends, I'd argue too much time on screens. The effect of the pandemic on close family members had a staggering toll on the country. Children's hospitals saw mental health emergencies among 5 to 17-year-olds increased by 14% in the first half of 2021 compared to 2019, and a 45% increase in self-injury and suicide for children in that age group. Pediatric hospital needs, pediatric mental health care needs are greater than they've ever been. We need to be sure that everyone who has a mental health crisis or has an ongoing mental health problem has the help that they need when they need it. The bipartisan legislation we're debating today expands access to high-quality mental health and behavioral health through what Senator Stabenow and I will point out we believe to be a truly proven model of community-based care. The Excellence in Mental Health program, a program that we brought to the floor in 2013 and then got signed into law in 2014. At the time, Senator Stabenow mentioned that bill marked the most significant expansion of community mental health and addiction services in decades. When we pass this bill, it will be even more dramatic in its long-term impact. And we've worked on these issues together with pilot states. We've worked on these issues together that brought projects in individual states that weren't part of that 8-state and eventually 9-state pilot. And so today we're able to come with 5 years of history in this program, a reimbursement model that matters and results that we think make a big difference. And I'm glad to be here with my good friend from Michigan, and we're going to kind of do this together for the next few minutes, talk about what can happen because of a critical piece of this community safety bill that is in so many ways a mental health and mental health delivery bill that we're going to see expanded in the country in unique ways. And Senator Stabenow, I'd like to turn to you for a few minutes to talk about this, and then I've got some things I want to say too.
Well, thank you, Senator Blunt.